Hey everyone, thanks for joining me today. I'm Angelica Carolino from the York Wellness and Lifestyle blog. So today we're talking about oral health, which I feel is an often neglected aspect of overall health. Sure, you might be eating well or going to the gym, but when was the last time you visited the dentist? Okay, folks, oral health is a very, very important aspect of your overall health. I mean, who here has had to cancel plans or call in a sick day because of a pesky toothache? Yeah, am I right? Yeah, I thought so. I mean, honestly, it has happened to me, and I totally could not function because the pain was literally killing me. Yeah, so maybe you're asking just what is oral health? Short answer is this: it's basically the practice of keeping your mouth, teeth, and gums healthy and free from disease and other problems like bad breath. It is super important that the oral hygiene is carried out every single freaking day, people. Okay? Every day. I mean, obviously, a healthy mouth helps you enjoy life because, of course, you can eat, speak, and smile in comfort and confidence, which, to be honest, can help you feel physically, mentally, and socially well. So, yeah, I sure hope you guys have been keeping your pearly whites in tip-top shape. Actually, as I was writing the original blog article, I couldn't help but wonder how people with poor oral health could stand it inside their face masks all day. People could probably pass out from smelling their bad breath for hours on end, no? Well, anyway, yeah, I digress. You can read more of how bad oral health can literally make you sick with serious diseases like Alzheimer's, endocarditis, and, gentlemen, believe it or not, it can cause erectile dysfunction. So the link to the blog is posted in the caption or in the bio. So yeah, do check that out. Today we actually have a very special guest who also happens to be a very good friend of mine, Dr. Karla Cuison of K Dental Studios. So this past week, we asked our fans and followers on social media to ask Dr. Cuison any questions they've been too shy to ask their own dentists. And trust me, there were a lot of questions, and most of them were very intriguing. So, without further ado, everyone, let's please welcome Dr. Karla Cuison of K Dental Studios.
Hello, Angel and friends. Thanks so much for inviting me to this episode. I really pray that I'll be a big help in answering your dental-related questions.
Alright, so let's get straight into the questions as we have quite a few. The first one is from Smith26. He's asking, how often should I have a dental exam?
Okay, just by maintaining your health through an annual exam, it is best to visit the dentist at least once a year. Like what they always say, prevention is always better than cure. If you go to the dentist at least once a year, that will allow the dentist to see if there is any developing cavities, and if there is none, the dentist can actually do fluoride treatment to prevent any cavities from developing. And also, they are not only watching out for cavities, but also gum problems and any other lesions that might be developing inside the mouth.
There you have it, folks. We have heard it from the dentist. Go see your personal dentist at least once a year. So it's almost the end of the year. And if you haven't seen your dentist this year, I suggest that you go set a schedule or an appointment with them before the holiday rush creeps up on you. Right, so let's check the next question. This question is from Jess Ashley, and she is asking, what is your opinion on regular versus electric toothbrushes?
Okay, they both have their advantages and disadvantages. Studies have shown that to be able to clean 75% of plaque, you need to brush your teeth with a manual toothbrush for 6 minutes at least, and electric toothbrush for only 1 minute. So, one great advantage of electric toothbrushes is that it really lessens the amount of time you need to clean your teeth. So, this is recommended for very busy people. Of course, brushing has to be done ideally after every meal because, like I said, studies have shown that only 75% of plaque is removed in that amount of time. So we can never be sure to really remove 100%. Or if you want to remove 100% of plaque, you have to do it all the time because after eating, plaque forms immediately on your teeth. The disadvantage of electric toothbrushes is that the battery lifetime is really not that good, even the rechargeable ones. So after some time, you really have to change it. Otherwise, you have to keep charging it just to be able to use it. And of course, they're more bulky and more expensive, unlike regular or manual toothbrushes. Manual toothbrushes, on the other hand, are light and you have more control. Manual toothbrushes are best for people who do not have dexterity problems. And for me, I wouldn't really recommend one from the other. The more important thing is that you brush your teeth for at least 6 minutes for the manual toothbrushes or 1 minute for electric toothbrushes after every meal. If you cannot do that, just brush more often and it really is just patient preference.
Wow, so many insights right there. I didn't even realize that number one, plaque forms immediately after you eat, and also that you have to brush your teeth for at least 6 minutes with a manual toothbrush. Wow, that's amazing. So I guess the birthday song is not that long. Maybe two birthday songs would be sufficient. So guys, it doesn't really matter which type of toothbrush you choose to use, but I guess what's more important is that you actually brush your teeth regularly and frequently. Okay? So let's go to the next question. We have Akshay Dama asking, how do you choose a good toothpaste?
Personally, toothpastes are just adjunct. More important is that there is a mechanical removal of plaque and food debris. So even if there is no toothpaste, you can just brush your teeth. I do not recommend any brand, but what helps me choose between the different toothpastes out there is number one, I choose white plain ones, then over the colored ones, because the colored ones can stain your teeth. Number two, I would get the one with fluoride, unless your water is already fluoridated. If your water is fluoridated, then don't get the one with the fluoride. Number three is I would avoid toothpastes with crystals. Anything that is abrasive because it can abrade your teeth, making it more sensitive. So I would really prefer plain ones.
That is fantastic. So you heard her dentist. She prefers the plain white toothpaste with fluoride. Alright, so next we have Julia asking, any advice for patients with anxiety about going to the dentist?
Well, first, we have to get to the root of the problem. Why are you anxious? Is this because of trauma, bad dentist experience, or did your parents use the dentist as a threat and that developed into fear? I really think it all boils down to the why. Why do we have to go to the dentist? If we wait until we have a toothache before going to the dentist, then you will really have a bad experience and you will attribute that pain that you experience to the dentist. But, in actuality, it's really because of that toothache. What I can recommend also is you have to choose a dentist whom you're comfortable with, and a clinic which makes you at ease too. The instruments or equipments that most dentists use now have really improved a lot, and the equipments are not as scary as before. So you might really be surprised if you go to the dentist now and some clinics really do like spas, so you will really feel relaxed and comfortable.
Fantastic advice once again. Yeah, make it a point to go to a dentist that you're actually comfortable with. The aesthetics would be second. I would have to agree that dental clinics nowadays feel less medical or dental. And most of them feel like a friend stylish condo or even a spa, as Dr. Cuison said. We wish you luck, Julia. We hope you find a dentist that you're comfortable with. Now let's see who we have for the next question. Oh, okay, so we have Abhijit Singh asking, hi, what is the best way to manage dental health if you're a smoker? Any suggestions?
Smoking affects oxygen tension in the gums. This results in delayed healing as well as compromised immune response of the gums from plaque and bacteria. Thus, I recommend smokers to have their teeth cleaned more often than non-smokers, at least 3 to 4 times a year for dental cleaning and fluoride treatment. Also, studies have shown that smoking affects the salivary flow rate. This is the amount of saliva or spit that is produced in the mouth. This leads to dry mouth. Saliva is very important because it protects our teeth from cavities, making smokers more at risk in developing cavities. Thus, going to the dentist more often is recommended, not just for dental cleaning but also for fluoride treatment. Also, chewing sugar-free gums to stimulate more saliva can also prevent dry mouth. So going to the dentist 3 to 4 times a year will also help your dentist to be able to monitor any developing lesions in the mouth, since smokers are predisposed to oral cancer.
Okay, so smokers, don't forget that you have to visit your dentist 3 to 4 times a year, not only for cleaning but also for fluoride treatment. All right, so up next we have Nana Tuwer. Sorry if I botched your name, but Nana is asking, should I use mouthwash or is flossing enough?
Mouthwash and toothpaste are only adjuncts or supplementary to our oral hygiene. The main characters that play a role in our oral hygiene are toothbrushing and flossing. These will mechanically remove plaque and food debris. Personally, I like using toothpaste because of the minty feel it leaves my mouth. And for those patients who are at high caries risk, fluoridated toothpaste and mouthwash will be a big help in reducing cavities too. Also, for food that really leaves bad odor in the mouth like onion or garlic, mouthwash really helps remove the bad odor.
I see. So mouthwash is really just a supplement to your oral hygiene routine, but what's more important is brushing and flossing. Got that. Thank you, Doc. Okay, now let's see who the next question is from. Oh, okay, great. This question is from a dash of Ayu, my friend Aisha. Aisha is asking, is it really necessary to get dental cleaning every 6 months?
Well, maintenance of your teeth will depend on your oral hygiene and other factors like smoking. And if patient has a high caries risk, or this means that the patient is more prone to cavities. And this will be evaluated by your dentist. And some patients who have excellent oral hygiene can just visit the dentist once a year. But like what I said in the previous question, if you are a smoker, you probably need to see your dentist 3 to 4 times a year.
Got that, Doc. So there are other factors that one should consider before they book an appointment with their dentist. Right. Okay, so the next question we have is very interesting. It comes from Kartik B, and he's asking, does the acidity of sparkling water damage your teeth if consumed regularly?
Yes, it can, especially if there's a long-term habit. The acidity can actually soften your enamel and make it more porous. I recommend that if you consume carbonated drinks, neutralize it with water right after. I will also advise that if you like drinking acidic drinks, let's say like orange juice, don't eat or drink anything dark colored like coffee because the softened enamel will easily stain.
Oh my goodness, I didn't realize that my beverage habits are actually also affecting my teeth. So I always thought that it was only red wine that stains teeth. I only came to realize now that even orange juice
Okay,
can do
so
that.
we are actually down to our last question, and of course, I saved the best for last. S Chan17 is asking, what's the grossest procedure you've performed?
Well, I think since I'm in the medical field, gross is a description I cannot use. It will be probably gross for people not in the medical field, but maybe because I'm so used to seeing these cases that I really don't consider them gross anymore.
Very classy way to answer that question, Doc, and we totally understand that doctor-patient confidentiality is of utmost importance even in dentistry. So sorry, Stephanie. Okay, so that was a very insightful 10 minutes with Dr. Cuison. Doc, thank you again for coming on to the show and answering our fans and followers' most pressing dental questions.
Thank you everyone for listening. I hope in a way I was able to answer your inquiries. For those who are asking, my practice is in the Philippines. It's in the heart of Ortigas, Metro Manila. You can check out my website. It's kdentalstudio.com. When this pandemic is over, hope to see some of you too. Praying for everyone's safety and God bless you guys. Bye!
Alrighty, that's it for today's podcast. You can head on over to our blog to read Dr. Cuison's 5 simple tips on how you can have a healthy mouth. This has been Angelica Carolino for the York University SCS Wellness and Lifestyle blog. I wish you all a great weekend ahead.